Well, hey, welcome. This is Linda. Here's to Your Good Health. My name is Linda Prezioso. I'm kind of not with the program yet. Police said, "Are you ready?" Yeah, I'm ready. I don't think I'm ready, but anyway, I'm Linda Prezioso. I'm a nurse practitioner at Family Medical Center, and this is Here's to Your Good Health. It's a program for you, by you, and about you. WHIG graciously sponsors this program because they're very community oriented, and being healthy is part of a good community. And so that's where I come in on Wednesday evenings. I was not here last Wednesday. I was in South Carolina freezing my little tush off. It was cold, y'all. I went to a conference. It was Wednesday. I left Wednesday and I came home Saturday. And I had a great time. I went by myself. A friend of mine was supposed to go with, and she canceled at the last minute, and that's okay. So I really got an opportunity to network with other nurse practitioners and talk to other nurse practitioners. And, you know, that's really what it's supposed to be about, not about me spending time with my friend when I'm not in the classroom. So it was good. There was a lot of good information given, and I really enjoyed myself. One of the things that well, there were several topics, of course. One was nurse practitioners being autonomous. And there are several states that nurse practitioners can practice independently without a medical doctor supervisor. North Carolina is looking into that and has looked into it multiple times. The problem we run into is the medical board. They want to control nursing, and we're not doctors. We, certainly work in the medical profession, but we have our own board, and we have a board of nursing which is very strict in North Carolina. I don't know about other states. This is the only state I've practiced in as a nurse, but they have a great oversight of all of us, and make sure that we are on the up and up. And you've got to turn in your licensure, you've got to turn in your education, your continuing education. For a nurse practitioner, I have to get 50 hours a year, and that's a lot of education. Most conferences are about 20, so you have to do at least 2 conferences, it seems, and then a few other areas in between, which I really don't mind, don't get me wrong, but my point is, I've been a nurse for 30 years. I've been a nurse practitioner for 9 or 10 years. And, I've never gotten into trouble. I've never had the board had to look into me or anything like that. But, nurse practitioners can have their own clinic. It's a little bit more strict for physician's assistants, and I'm not sure exactly what all their rules and regs are because I'm not a physician's assistant. So I don't even want to go into that and address them. But nurse practitioners, most of us are entrepreneurs. Lots of us have our own clinics. Some work like I do at Family Medical, but there's a lot of nurses that have their own clinic. So there's an act that's in legislature now. I'm not sure when it's going to be voted on. It's called the SAFE Act, and that part of that would be that nurse practitioners could work autonomously. I would not have to have a medical supervisor, and I would not have to pay him X amount of dollars a month for the privilege of having my own clinic or my own office or whatever I wanted. So, we're good enough to give the docs the $500 to $1,000 a month for their oversight, of which that really is very limited. I mean, they don't come to the office or anything. They have to be available to us by phone. So if I say, "Dr. Jones, I've got this patient here and I just am not sure what to do," they've got to be available to me like that. And that's good. I mean, nurse practitioners are like physician's assistants. We know a lot. We can diagnose and treat, and we can write prescriptions. But we don't know it all. We don't have the benefit of the 8 years of education that docs have. And then they have a residency and, an internship and all that. So they certainly have much more education. And they deserve every title that they get, and they deserve their paychecks. I'm not saying any of that. But what I am saying is we as nurse practitioners want to be autonomous. When I was in South Carolina, I went to a policy and procedure talk, and it was primarily on South Carolina, because that's where we were, but they did address a little bit of North Carolina. But something that really stuck in my craw and just made me really upset was that she was talking about the cost to in North Carolina. They have a PAC, a PAC. I don't know what that is. It's some kind of a political, I guess it's a political action something. Anyway, you know, you can donate to these PACs, and then they work on getting certain things done. Well, so there's a nurse practitioner PAC. I don't know the name of it other than that. But in South Carolina, they're also pushing for this same autonomy for nurses. Now, Florida has it. I think there's about 16 or 20 states that do have autonomy for nurse practitioners to have their own place. But she said that in the state of South Carolina, and I don't have any reason to believe it's much different or any different at all here, it costs that PAC group, that nursing association, $100,000 to try get their bill passed. Now, isn't that ridiculous? Think of what $100,000 could do in this community alone, let alone, you know, I mean, the cost of politics is just outrageous, in my opinion. You know, they're supposed to be there to serve us, and I think that a lot of them serve themselves more than they serve us. I don't like to get political. I have my own beliefs. I have my own ideas, and if anybody wants to ask my opinion, I will give it. But this is not the place or the forum. But what I ask you, if anybody, you might know nurses, you might have a niece or a daughter that's a nurse practitioner, and I would just encourage you to contact your state representative and your state senator. I've already written to both of mine, and the bill isn't even going up until in the fall, but I wanted to put a little bug in their ears saying, you know, this is one constituent and this is what she wants. And then I'll write another letter as it gets closer to going into a vote. So if any of you have any nurses or nurse practitioners that you are interested in or know of or have a family member, just talk to them about it and see what their thoughts are, and maybe a few more letters from folks like you would make a difference in their decision in the fall in the legislature of North Carolina. Okay, enough about that. That was one of the things I learned. I was trying to go over in my brain all the different classes. They kind of all run into one, and I haven't looked at my PowerPoint yet that they gave me the zip drive for, so I'll probably do that this weekend. But last weekend I didn't get home till Saturday about 2 o'clock, and after you drive all day, you're just kind of pooped and wiped out, so I didn't get a whole lot done. I got the laundry done and put away the food that I had brought that hadn't eaten, that kind of thing. But so I haven't had a chance to look at that yet, and then of course Monday came way too fast and back at the old grind, so to speak. But I will look at it. We had a talk from a pharmacist that was interesting. It's always interesting to hear about drugs and newer drugs and side effects of drugs, and he talked a lot about the scheduled drugs and how those are the ones that you have to have a DEA number for, and you have to pay the government to have this number, and then you're allowed to write, like oxycodone and tramadol and Lyrica. Some things are scheduled drugs. And so he talked about that. He talked about how the DEA was formed. That was very interesting. I always like the history behind things. And then another talk that we had was one of the ladies that organized the conference. She and there's two nurse practitioners, and they're both retired military, and they run 2 of these conferences a year. I'd never been to theirs before, and so I decided I'd just take a chance and see what it was like. It was very good. I enjoyed it. but one lady, she is all about plant-based diet. She does not eat any meat. She does not eat any processed foods. She does not eat any cupcakes, cookies, pie, anything like that. She does have a glass of red wine every night because that, you know, a glass of wine at night is supposed to be beneficial for your heart. But as she was speaking, and we're going to talk about plant-based diets a little bit tonight, but as she was speaking, she said when she was 68 years old when she went ahead and started the plant-based diet because she just didn't feel good. And she, you know, she was tired all the time and sluggish all the time, and she didn't like the way she felt. And so she, you know, as all of us nurses do, we research and we look into and we detail things, and she really felt like the plant-based diet was what she wanted. So at age 68, she went on total plants. She doesn't eat any meat. She gets her protein from like beans, rice, because beans and rice form a perfect protein, the two of them. A lot of legumes have protein. What's that soy product? Tofu. That's a good plant-based protein. Anyway, she lost 50 pounds. Now, this was at age 68 she started this. And she said she'd been eating that way for 12 years. And so my brain's going, 68 plus 12. That lady was 80 years old, and she's still up teaching, driving back and forth, you know, packing up her truck with all of the equipment. You know, you got to have microphones and computers and help get the desks set up and all that kind of stuff. And I thought, maybe there's something to this plant-based diet, because she seemed like she had more energy than me, and I'm not 80 years old. So. And my daughter has gone to all plant-based. Her husband is what she calls a pescatarian. He will eat bread and butter. You know, butter is from an animal. So I forget which one's a vegan and one's a vegetarian, but my son-in-law will eat fish and mostly vegetables. And my daughter had a little bit of an elevated cholesterol. I mean, minutely elevated, to the point that I would have told my patient, absolutely don't worry about it. Her provider told her, do not worry about it. Her mother told her, do not worry about it. But Sarah, when she's like a dog with a bone, when she grabs onto something, she's going to do it. So she decided that she was going to eat strict vegetarian for 6 weeks, and then she wanted to have her cholesterol redrawn and see if it made a difference in her cholesterol. Well, I'm sure it will, because it was minutely elevated. But so I started, you know, I've just been interested in it, and her husband has been a vegetarian for quite a while. Now, he'll eat meat if you know, we all have a pork chop and there's one left and he's still hungry, he'll eat the pork chop. But for the most part, they don't cook meat at their house. And so I just, you know, I was pretty interested in this plant-based diet that this lady was talking about and all the benefits of it. So we're going to talk about that for a little bit tonight. We're going to talk about how it affects diabetes, because, you know, that's such a big problem here, well, in the whole United States. Obesity is a huge problem in the United States. And so much of it is preventable if you eat good, healthy food. But you've got to cook it yourself. You've got to prepare it yourself. You've got to eat it fresh. Anything in a can or a box is pretty much taboo. Now, I've got some canned green beans for, you know, something on this in a minute to get done. I've got some canned soup. So I am not such a so stuck on it that I wouldn't even buy a can of soup. Because sometimes I just don't want to cook and I don't have anything, and I'll open a can of soup and eat that for supper. I eat bowls of cereal sometimes for supper, because I get home and I'm tired and Bob hasn't cooked and I don't want to cook. So I'll do that. I did that a lot when I worked 12-hour shifts, because by the time you got off at 7:15, made sure the count and everything was right before you could leave the hospital. Then you drove home. It was near 8 o'clock when you got home. And if you had to go to work the next day, it's a short night before you got to get up at 5 in the morning again. So a lot of time, and you don't want to go to bed with a big heavy meal on your tummy. So a lot of times I did eat a bowl of cereal. And there's nothing wrong with cereal, I don't think. It's a plant. It is wrong if you got it full of sugar and marshmallows and cocoa chips and all the crazy cereals that they have now, you know. But just like I like Bran flakes, and Bran, you know, that's good for anybody that has trouble passing their bowels. Bran is what is recommended, along with fresh fruits and vegetables and exercise and water, to move that along. You know, it's high in fiber. A plant-based diet is high in fiber, so that helps you go through the elimination process without any problems. So there's a lot of good to it. It's just that it's so foreign to our society and so foreign to, you know, I mean, like I went to the food truck rodeo in rodeo, I always say radio, the rodeo in Red Oak, and it was a bunch of food trucks in Red Oak at the Ennis Park. I just wanted to go and see what they had. You know, they had fried Snickers, fried Oreos. They had, you know, like hamburgers and hot dogs and corn dogs and French fries. You know, none of that's healthy. It's all greasy. They had some kind of tacos with collards. I wasn't sure what that was all about. I don't like collards. I didn't even go near that place. Then they had a home cooking truck that had, you know, like barbecue and collard greens and black-eyed peas and stuff like that. And none of it was really healthy. I think probably the country cooking one wasn't too bad. And then they had you could get a pineapple, and it was full of shaved ice. So that isn't really too bad, although it's a sugary, sugar water flavoring that they put over it. I had one of those. I had a mango. It was pretty good, actually. I ate half of it and brought the other half home to Bob, and he ate it. But my point is, you know, you do fun things like that, but there's nothing healthy for you. And then if you know, you want to get something healthy, people look at you like you're a freak. So, and that's our society as a whole. We don't eat well. We don't eat healthy. You know, we'll run through a drive-through in a minute to pick up a burger and fries because we've got to run to a baseball game or whatever. I mean, I don't want to bash people, and I don't want people to think that I'm not sympathetic. I remember when I had 3 kids and I was going to dance classes and I was going to soccer games and I was going to baseball practice, and you know, there was 3 kids going 3 different ways and only 2 of us parents, so I always had to rely on a friend or somebody to pick up one kid and take him someplace and take him back home. So I remember those days. You know, you come home from work, the ball game's at 6 o'clock, you go to the ball game, it gets done at 8, you stop at get a burger on the way home because everybody's hungry, and Mama sure doesn't want to cook when she's been working all day and then sitting on a ball field for 2 hours. So I get it, but we've just got to be better with what we do. All right, it's time for our first break, so we're going to take that break, and then when we come back, we'll talk more about plant-based diet. I'll see you in just a minute.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Downey's Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Downey's Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Well, hey, welcome back. This is Here's to Your Good Health. I wanted to let you know I am live tonight, so if you have something that you want to talk about other than listen to me drone on about eating plants, give us a call at 407-1111. And I will try to remember to keep my eye on this phone because I'm not good at that, but I will try. So I'm going to talk a little bit about plants and why we should eat them more. You know, I'm a big believer in all natural things. I think you all know that. And I'm also a big believer in if God made it, we should be able to ingest it. So I don't know if I'm 100% pro all vegetables, no meat. I don't think I am. I think that we should eat a lot more vegetables. The diabetic standard for a good diet is half of your plate, breakfast, lunch, dinner, half of it should be fruits and vegetables. Then a quarter of it is your carbohydrate, some vegetables are carbohydrates because they've got a lot of starch in them, corn, butter beans, sweet peas, things like that. Or a slice of bread or a roll, and then a quarter of it is your piece of meat. And your meat, your portion of meat should be the size of the palm of your hand. So mine's about the size of a pack of playing cards, maybe a little bit bigger. So, that's probably 3 or 4 ounces of like a steak, and that's really enough. We think that we have to have the big 20-ounce steak. We don't have to have that. We think we have to have all this protein, that we should be drinking protein shakes. Well, protein is good for you because we need protein to build our muscles and our cells. but it's also good for you because it fills you up. You know, plants and carbohydrates don't fill you up as much, nor do they stay with you as long. So that's kind of the reason why we eat some protein, in my opinion. But we're going to talk a lot about plants and why we should eat as many as we do, and why we, and I mean, just as I said, the diabetic guidelines say that half of your plate is fruits and vegetables. That's all plant-based. And if we all ate that and ate the portion that we're supposed to, we would all look and feel great. Now, I just want you to know that even though I believe in this and I try to adhere to it, I did eat 2 donuts yesterday. So I get a sweet tooth every once in a while, and yesterday was one of those days, and somebody had brought donuts, and I ate 2 of them. So when I'm sitting here talking to you, it's not like I'm Miss Perfect and I don't mess up, because I am not Miss Perfect and I do mess up. I'm telling you what I know from reading, and I'm telling you what I know from talking to other people, and I'm telling you what I know in my brain. I'm not telling you what I do all the time, because what I know and I'm supposed to do and I do are 2 different things. And I'm sure everybody that is out there watching feels the same way, that you know, I was great today, did everything right, and then I had, you know, a brownie, whatever. I try not to keep that stuff at home, but sometimes you just got to have a little bit. Anyway, so a plant-based diet is eating more vegetables, fruits, whole grains, beans, legumes, nuts, and seeds. You should minimize your intake of animal foods like meat, eggs, and dairy. Now this is written, where was this in? This is in a Diet and Nutrition magazine. And so this author, Melissa Lamar, she feels that you don't have to exclude these, the meat, and eggs, dairy exclusively, that you can have a little bit of it. I tend to agree with her. But some people are just only going to eat plants. And, you know, like the lady that taught that class that I was in South Carolina, she never eats sugar. She doesn't even crave it. You know, sugar is so highly addictive, and that's one reason why we keep doing it, even though we really don't even want it, but you just get a taste for it and you got to have it, like me with those donuts yesterday. But research has found that a plant-based diet is very beneficial. It can improve heart health, reduce your risk of cancer and diabetes, and then she says even help the environment. I guess you don't have cow pies if you have all plants and vegetables, and what you don't eat you can turn into compost. I don't know. She didn't give me any ideas of how that protected the environment. So. And so if you're interested in trying this healthy diet, she says, here's some foods to get you going, to start your day. So, you know, a plant-based diet encourages eating whole plant-based foods, minimizing animal products and processed foods. And processed foods are a big no-no for me. I very rarely eat a processed food. They're full of sugar, fat, and salt, and they're addictive, and there's very little, if any, nutritional value in anything processed. I do not eat deli meat. You know, if I went to your house and you made me a ham and cheese sandwich of deli meat, I would eat it. Don't get me wrong, but I do not eat any deli meat. Sometimes we will if we're going camping or something, but as a whole, I don't eat like that. And if I want, you know, if I'm going to have a roast beef sandwich, I have cooked the beef and I slice it for a sandwich, or the chicken, or the pork, or the turkey. That's how I do it. So eating some animal products, you know, is the difference between a vegan and a vegetarian, and I can't remember which is which. Oh, here it is. A vegan diet excludes all animal products, and a vegetarian diet excludes animal meat. plant-based diets don't include these restrictions. So a vegan excludes all animal products. So that's milk, butter, cottage cheese, and then the vegetarian, you can have the butter and the milk and those kind of things, but you don't eat the animal meat. And then, you know, plant-based diets don't have those restrictions, but they recommend that you eat mostly all plants and not anything else. So the foods, you know, I mentioned before, vegetables, fruits, legumes, beans, grains, nuts, and then smaller or less frequently is meat, dairy products, and eggs. I remember when we lived in California and we had some friends that they would have meatless Mondays. This was before it was popular. Now it's a thing. But and so, you know, they invited us over for dinner, but she said, we're not having meat tonight. It's going to be, I think it was chili and baked potato or something. I said, that's great. Doesn't matter to me. If anybody else cooks for me, I love it. I don't need anything else. So, you know, I also tried to find out some ways that plant-based diet and diabetes, does it lower the risk? Does it, you know, help you to control your diabetes? And the answer is yes. So a plant-based diet is substantially linked to lowering the risk of type 2 diabetes. And the study highlights that even a moderate dietary change in the direction of a healthful plant-based diet can significantly play a role in the prevention of type 2 diabetes. And this said, you know, a moderate dietary change. So, you know, you don't have to say, okay, I'm never eating plants again. I mean, meat again. I'm only going to eat plants. You don't have to do that. Just instead of the one snack that was maybe a meat stick or some, oh, what's that meat that they dry and eat? Jerky. You know, maybe instead of jerky, you had some I don't know, nuts or celery sticks or something. You know, just gradually add more fruits and vegetables into your diet and slowly take away some of the other things that have more meat products in it, you know. Now we have chickens and we eat a lot of eggs, so I don't know if I can give that up, because not that I love the eggs so much, but you know, we have them because we have chickens and I'm not going to let it go to waste. So so this lady is a postdoctoral fellow in the Department of Nutrition, and she wrote this study. And you know, she went on. She's going on to chronicalize the support for the dietary recommendations and for chronic disease prevention. And that's why this lady that was at the conference I was at, that's one reason why she, you know, she went to plant-based, because she wanted to get healthy again. She wanted to get off her blood pressure medicine. She wanted to get off of the cholesterol medicine. But now her roommate, who is the other part of the two ladies that do this, she, even though she only eats plant-based, she still has to take cholesterol medicine, because sometimes it's in our genes. It's what Grandma and Grandpa and Mom and Dad gave us. We can't control that. You know, there are all these disease processes. They're not all stemming from poor eating habits, although a lot of them are. I'd say 90% are. But there are some people that just, they have the high cholesterol and they can't get out of that. So this lady does eat all plants, but she does take a cholesterol medicine too. Both of them are off of their blood pressure medicine. They didn't say anything about diabetes, so I don't know if they have that or not. So there's been lots of studies that shows reducing the risk of type 2 diabetes. But this is the first study to make the distinction between healthy plant-based diets and less healthy ones that include sweetened foods and beverages. And you know, sweetened beverages is probably one of the biggest contributors to obesity. I can't tell you how many people I say quit drinking sodas, whether they're diet or not, and you will lose 20 pounds. And that pretty much all the time happens. The same with sweet tea. You know, I've been on my soapbox about sweet tea here before. I don't mind somebody putting, you know, a little bit of sugar in the tea to kind of break the bitter taste. I mean, I like it unsweet. I was raised that way. But, you know, some of these teas, they're like syrups, dude. They are full of sugar. And that is just empty calories. You're putting on calories by drinking a glass of tea. You know, so limit your tea to one glass of half and half, or 3/4 on to 1/4 sweet, and then drink water the rest of the time. It's just what we've got to do. So this study was published in 2016. So it's, you know, that's 5 years ago. So I'm sure there's been more since then. But they have found links between vegetarian diets and improved health outcomes, and including reducing the risk of diabetes. And this one is the first to make distinctions between healthy plant-based diets and less healthy ones that include the sweetened foods and beverages, which are, this says may be detrimental. I just go as far as say it is detrimental for our health. This study also considered the effect of some meat animal foods in our diet. The researchers followed more than 200,000 male and female health professionals across the U.S. for 20 years, who regularly filled out questionnaires on their diet, lifestyle, medical history, new disease diagnosis as part of the 3 long-term studies. While researchers evaluated participants' diets using plant-based diet index, which they assigned, the plant-derived foods got higher scores and animal-derived foods got lower scores. So it's time for our second break, and then we'll go back into this and show you. I've got some percentages of what we can do to decrease or increase our health risk by what we eat. So we'll be right back in just a few minutes with more of Here's to Your Good Health. Don't go away.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Downey's Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Downey's Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal. providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hey there, welcome back. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center, and we are talking tonight about a plant-based diet, and now we've moved into how that can affect your health, how it can lower the potential for some chronic diseases such as diabetes. So this study we've been talking about found that high adherence to plant-based diet was low in animal foods was associated with a 20% risk of reduced risk of type 2 diabetes, compared with the low adherence to such a diet, to low adherence to the diet. So in other words, high adherence to eating plant-based, 20% reduction in possibility of diabetes versus if you ate other things, and then eating a healthy version of the plant-based diet, which would include, a little bit of meat, maybe some butter, maybe some cottage cheese, maybe some milk. Eating that was linked to 34% lower risk in diabetes compared to the less healthy version, which included refined grains, not whole grains, refined grains, potatoes, sugar-sweetened beverages, and that had a 16% higher risk of getting diabetes. So even moderately lowering animal food consumption from 5 to 6 servings a day to 4 servings a day. I don't eat 5, well, I guess it's animal food, so I'm thinking I don't eat 5 servings of meat a day, but I do put butter on my bread, and I did have some cheese and crackers today for a snack. So though the cheese and the butter would be animal food as well. Anyway, if you go from 5 to 6 servings a day down to 4 or 3, you can lower your incidence of diabetes. So the whole thing here is the more plants and vegetables you eat, vegetables and fruits, whole grains, legumes, nuts, seeds, and you lower your animal intake, especially red and processed meats, and I've already told you about processed meats, you can have substantial health benefits, reducing your risk of type 2 diabetes. And you know, I don't think I brought the statistics of diabetes, but well, here, yeah, I did. Here's some. 34.2 million adults in the U.S. have diabetes. 1 of 5 of them don't know that you have it. A lot of us have diabetes and we don't know it because there's different ways of measuring it and figuring out, and some people don't come to the doctor, and when they do, they don't get blood drawn. And diabetes is the 7th leading cause of death in the United States. Diabetes is the #1 cause of kidney failure, lower limb amputations, and adult blindness. And in the last 20 years, the number of adults diagnosed with diabetes has more than doubled. So that's some of your statistics for diabetes. So if we can, you know, lower that risk by eating a few more plants and a little bit less meat or animal products, butter, milk, etc., I think it's worth a try. I think it's worth, you know, maybe if you like breakfast meat, you know, maybe you like a piece of sausage, an egg, well then eat a salad for lunch. And for supper, maybe no meat, just another plate full of, I don't know, steamed vegetables. I've got green beans, and I made some broccoli. I don't like broccoli. I eat it because it's a really health food, but it's not my first choice. But I took just a small amount of olive oil, or you could even use like some chicken broth or something if you didn't want to use the oil. And I put in lots of garlic and salt and pepper, and I had steamed the broccoli until it was like a real bright, vibrant green. And then I took it out of the water and put it in the pan with a little bit of oil and all that garlic and onion and salt and pepper. And I actually almost liked it. I mean, I eat it, like I said, because it's one of the superfoods, and it's we're supposed to eat lots of dark green leafy vegetables, of which broccoli is one. And I do like spinach raw. I do like cabbage. That's really not a dark, it's leafy green, but it's not dark. But as far as like kale and collards and that kind of stuff, I just don't like it. I just don't. So, well, Randy. Oh, Randy's back, y'all. You know, I don't know if you've seen him. I haven't seen him since he was really sick in the hospital with COVID. And so I think I'm going to try have him on my show one night, and we can talk about, he had a terrible, terrible, terrible time, and it's so good to see him. He looks the same. He's got a bright, better now. He says he's better now. That's great. All right. So, you know, we could just, if we would just give up one steak a week and eat broccoli and cabbage and green beans and instead, you know, with maybe a piece of whole wheat toast if you want some bread or something. Just think of how we could reduce our risk. Think of how much better we could be if we didn't have that one piece of meat. I mean, you know, it's really not a lot to give up. So, and then, you know, because we can lower the type 2 diabetes, and then we have higher fiber, which helps us to eliminate. There are antioxidants and unsaturated fatty acids, which we need in our body, micronutrients such as magnesium, and all these things are in the plants. And healthy plant foods also contribute to a healthy gut microbiome. And you know, our immune system, 60% of our immune system is in our gut. So if you've got a good, healthy gut, you're going to be a good, healthy person. So, you know, I'm just kind of all about the plant-based diet for the most part. I'm not going to give up meat. I'm not going to give up steak. I just bought an eighth of a steer from a chiropractor. Well, you know him, Alan Bolin. He comes on my show every once in a while. He works at Hammer Chiropractic, Dr. Alan Bolin, and he raises steers. And this is the second time I bought one from him, or bought a portion of it. You know, and it breaks down to $4.12 a pound. Now that's a T-bone steak. That's a chuck roast, and that's a pound of hamburger. You can't buy a pound of hamburger for $4.12 at the store, I don't think, and you certainly can't get one with the high meat, low fat content that you get from that. But anyway, so I'm not going to give that up because I've got a freezer full of meat, but I am not going to, my plate is going to be at least half full of fruits and vegetables and a small little piece of meat the size of a playing card deck. Let's see what else we got here. We talked about, you know, 422 million people in the world are affected by type 1 or type 2, and 8 million people have diabetes and don't know it. The most common type of diabetes is type 2, and this is when the cells of the body do not properly use the insulin that is produced and secreted by the pancreas. Initially, the pancreas produces more insulin to transport glucose to the cells. However, eventually, the pancreas is unable to produce enough insulin to maintain proper blood glucose levels. Although genetics can contribute to type 2, most people who get type 2 are overweight or obese, especially if you've got lots of belly fat. If you're not physically active, you're more likely to develop type 2. Certain conditions, like if you have gestational diabetes, if you have diabetes when you are pregnant, you are at a higher risk of developing type 2 diabetes as you grow older. And so here's some of the foods that we want to eat to keep the diabetes away. Whole grains, and you know that's just one of the big ones because I didn't copy any more of it. But whole grains is the more you process a food, like wheat. You know, wheat is brown. And if you process it to make white flour, you've lost all of that wholeness, all of that goodness, and that's what has the fiber, and that's what makes us healthy. So, like I said, the more you process foods, the worse it's going to be. And I didn't copy any more of those foods. I hate it. So I have no more to say about that at this point because it didn't come through. I should have checked it before I left work. But I was in a hurry and I got it done quick and I ran out the door because, I had a meeting Monday night and didn't get home till 8:30. I had a dinner date last night with somebody about some business and didn't get home till 8 or 8:30, and it'll be 8:30 before I get home tonight. So I was just ready to get out of the office and look at, I just really wanted to be outside because it's such a beautiful day. So I'm planting a garden. I've got plenty of plants in already, and I've still got some that I've been growing in my sunroom. I started from seeds, and it's just been so cool. I haven't wanted to put them out yet. So I'll be telling you about my garden as it grows and as that goes through. And then, of course, you know, Bob and I like to can and freeze, so we'll be putting up August is always a busy month for that because that's when everything comes in and you've got to get it done. So August is going to be busy. I'll probably take a couple days off just to get the canning and things done. But I enjoy doing that. I don't know, I think it's more healthy. I was raised that way. My mom did that, so maybe that's why. I don't know. But anyway. All right, it's time for me to say goodnight. It's so good to see you. I'm so glad you're going to see Randy tonight for those who like to watch Way Back Wednesday. I know there's plenty of people out there that do. And I will see you next week with more of Here's to Your Good Health. Now, I think I'm going to have a infectious disease doctor next week, and so that will be good because, well, we've never had one on this show, and we've never really had one in Rocky Mount before. There was one in Tarboro. She was there for several years, but her mama got sick and she moved back home, wherever home was. So we're really blessed to have an infectious disease because, you know, sometimes there's infections and things that go on, and it's just above and beyond all of our scope of practice. And so she specializes in that. So I'm looking forward to that. So I will see you next week with more of Here's to Your Good Health. Have a great week. Good night.